No. Good evening, ladies and gentlemen, and hello, YouTube Live. Dr. Sant has a wonderful lecture in store for you tonight. He also has an exciting announcement later in the lecture, so stay tuned, and it's not about retirement. Tonight's lecture will be very chiropractic oriented. We all have a story about why we chose this profession. Mine began when I was working in a hospital for 4 years as a patient transporter. In short, the mess I've seen behind closed doors is the reason I'm here at DHS today. It's sick care. It's not health care. And there's a reason that medical errors are the third leading cause of death in the United States today. And as many of your MDs, pediatricians, nurses, and friends want to bash our profession, we will gladly take them all on. My 11-year journey in this profession and at Diverse Health Services has been awesome. Tonight, you'll learn that the doctors of DHS have nothing but love, passion, and drive when it comes to helping others and your health. Michael Jordan once said, "Talent wins games, but teamwork and intelligence wins championships." If you want to win at life, you have to have a strong team. If you want to win your health back, you have to have a stronger team. And we're on your team, and we want the best for your health, and we will not give up. With that being said, here's Dr. Sant.
Thank you, Dr. Jeff. Mine. Well, our second lecture from my waiting room with the crisis that's going on, which we'll cover a little bit of that today. We have a big lecture for you today, a lot of interesting things going on. Stay tuned for a very special announcement that we talked to you about. I think you're going to find today kind of interesting. What is the most underutilized therapy? Sadly, my profession I consider to be the most underutilized therapy. I think I'm going to show you today why this has been so underutilized, and I think, not to step on some toes, but sometimes us chiropractors have been our own worst enemies. I'd like to show you a little more interesting approach to what's been going on in DHS for a number of years, and we're going to talk about what has not been utilized enough. So let's have some fun today, because we're going to have some crazy, slide it. December, the immune system is quite an interesting topic right now because everybody's worried about things, and we're going to cover some of that. So December, I'm going to resurrect some of my autoimmune stuff from that special vaccine lecture. We're going to cover some stuff on viruses, the immune system. It'll be a timely lecture for where we're at today. I expect you to find it very interesting. Dr. Jeff, on September 30th, we'll be talking about adrenal fatigue, which most everybody's suffering from. This week, I started my first patients Monday. I want to say hi to them because I know they're watching all the way from Dubai, Australia, New Zealand. You can Skype anywhere with DHS, and I've got lots of patients around the world. We're having a blast with them, and just want to say hello. Enjoy the lecture. You want to get connected. We have protocols everywhere. Instagram, YouTube, Facebook. Find our stuff because you can learn how to stay well, because right now it's going to take a little extra effort to stay well because what we just went through made it look like they're not that concerned if we do stay well. Stay tuned to DHS. Stuff that you'll watch. You know, I should say this. My tagline has become, "What's your story?" So you'll see me talk about that on Instagram because everybody's got a story to talk about. Like us on Facebook. Help us out. Subscribe on YouTube. Pretty straightforward. All our stuff's out there. Watch for our DHS protocols. Support DHS before Jeff Bezos swallows the entire world. He's going to swallow up the world. All right. What are you going to do with a case like this? A 16-year-old girl walks in my office. She's been to the ER. 1 year ago, she fell. 1 year ago. Now, if I hadn't seen a number of these, I would have went nuts watching this case. Let's have fun with this. Now, I want you to walk into the room, and the patient's doing that.
Last time Rachel was in here, it was twice as bad as this. And then we adjusted her atlas, and it stopped. How many months ago was that, Mom?
May, June, July, August. 3-4 months.
3-4 months ago. Now, I'm not remembering that we talked about how that atlas can slide on the brainstem.
Now, to walk into she's lucky I've seen this before. I've seen a number of these in 40 years, and she said a year ago she was in Texas marching down a street with a band. She fell over backwards and hit her head. 1 year later, she starts doing that. So she got an adjustment that you'll see eventually tonight. This is immediately after her adjustment.
Doctors are watching these. Now, Mom, come on over here. You're in. How many psychiatrists or psychologists?
Well, we had 2 psychologists
2 psychiatrists,
and 3 neurologists told us that.
3 neurologists,
And a counselor.
counselor.
Told her that it was in her head. She couldn't handle stress.
She's been in the emergency room.
2 emergency rooms. 3. Whatever, somewhere in there.
3 emergency rooms. She's been on a Valium IV, and she was basically told she was nuts. After the 1 atlas adjustment, this stops dead, and her life goes on like it was before. The doctors don't want to address that this was a mechanical problem, not an internal problem.
Now she's done that about 3 or 4 times. You have to hit that atlas perfectly and she'll stop dead. These little weenie adjustments are not going to do that. You want to know why you don't get these results? You got to do real adjustments. How much can chiropractic actually save? How much? What do you think that cost was for that girl? How much money do you think she put into that mess in the emergency room 3 times? Go to the emergency room once. How about this?
This is Janet. She's been a wonderful patient here for about 19 years now. She just reminded me of a story that I forgot about a long time ago, which is very disturbing. She had a terrible pain in her side. Can you show them where that pain was?
From the center of my back around this way into the center of my stomach.
Now, if you think it's possible to have $150,000 in tests on that pain, she claims that's how much money was spent trying to determine. Over $150,000 for that pain. Now, you came in the year 2000. I forgot about this story. What happened? How long did it take? Chiropractic doesn't work. To fix that $150,000 problem.
Within 30 seconds, you said, get on the table, you have a rib out, and I've never had the pain since.
Now, if you think this is a happy little story, how many $150,000 ribs do you think I've seen in 38 years? This is the nonsense that's going on. My favorite one was Jerry's mother. She got up off the table, hers was around her chest, it hurt right here. She stood up and said, that pain's gone over my heart. I got $40,000 into that pain. They know what they're doing. They know that there's mechanical issues out there, but they like making money. So $150,000 later, 1 rib adjustment, what's your story? Part 2.
There's more.
Continue.
It keeps going.
I was in Ohio Hospital
Over Christmas.
over Christmas, and they did a bunch of tests. Nothing, they knew nothing. They said, go home to your doctor there. So I got home, and I spent New Year's at Beaumont Hospital to have them do all the tests over because they wouldn't receive the tests from Ohio.
1 30-second rib. This is going on today as we speak. That's why the country's broke. Have a nice day.
No doctor would acknowledge what went on with this case. No one could even comprehend it was a rib out of place. So total, she had $250,000 in her stays because the rib was out of place. Now, after 40 years in practice, I could tell you a story about each one of these segments. C1, C2, C3, huge stories. They all relate to something. And if you've practiced long enough, you will know C3, I've fixed more shoulders with C3 professional athletes that had no pain in their neck. C4, I've fixed elbows that nobody could fix. 5 and 6, I've taken hand problems out, which you'll see some more of those. 7 takes out your shoulders. Jerry's mom, right about there, that rib was out. It came right around to the chest. That was $40,000. The Toronto Maple Leafs flew one of their goalies in some years ago. The piston trainer picked him up. I put his rib in place. They were puzzled. How could it possibly be this simple? And if you don't catch your ribs, what do you get? Shingles. Shingles loves to hit where your ribs are out of place. And that's classic. So you run around with those ribs out of place, you will be much more susceptible to a shingles issue. That's a lot of fun if you've ever had it. Now, I'm going to show you lots of neck and arm stuff. But when your organs are tangled up from the middle of your spine, they don't hurt much. So it's easy to have pinched nerves to your kidney, to your liver. By the time you figure that out, you're going to be a mess because the pain fibers aren't that prominent in those parts of your body. Correcting misalignments saves people injuries that they don't even understand because chiropractic has been ignored for way too long. The low back. Up here, 1, 2. If I told you how many sports hernias I fixed adjusting L1, L2, famous athletes, names everybody knows out there, retired from hernias that weren't hernias, it was L1, L2 takes this out. 2, 3 takes the hip, 3, 4 takes the knee. You can have no pain in your back and have nothing but pain in your knee, pain in your hip, pain in your groin. This is missed all the time, and I'm sorry to say the chiropractors miss it. Now, for the ladies out there in the crowd, if you want to grow your hair, skin, and nails back, lean to that calcium. That's for your hair, skin, and nails. People are losing tone today because they don't have any minerals in their body. Excellent calcium for women to grow parts, and that's the one I like to take, and I rotate between those two. Straight up great calcium, more for the hair, skin, and nails and other things. Adjust L2, L3 on a professional kicker who's retired from the NFL because his hip doesn't work. There's no way to adjust that twice and have him come in and say, this is impossible. I retired because of this hip pain. My back never hurt, just my hip. Millions were lost because the person on the team could not adjust L2, L3. There's the magic groin. When you have those groin injuries that nobody can figure out with no pain in your back. There's your knee. To watch people get their extremities fixed without any pain on their back is chiropractic. That's real chiropractic. And if you guys watching this are not getting those results, watch the lectures. Shoulder. I can't tell you how many of these I've done, and you got to know what you're doing to do this. Don't try to do this unless you know what's going on. You got to know how to test this guy to make sure he didn't tear a ligament.
So I went in, tested the reflex for the torn rotator cuff or the torn ligament on one side of the body that Dr. Rosendahl taught us. I cupped the shoulder, and I cupped the shoulder. 6 out of 7 did this. They didn't have a torn rotator cuff. When I had my hand on their shoulder, their arm went down. Because, hold tight. Relax this.
I've seen this one.
They watch the lectures.
And you know, when they haven't watched the lectures, those people that haven't seen the lectures make this easy. And I got it.
You got it.
You better be quick because you will irritate it if you don't.
When I watch the lectures, it makes it hard to adjust the shoulder. He knew what I was going to do before he did it, which was kind of funny. A special story. Only chiropractors are going to fix this. You got to find special chiropractors that have had a lot of training to learn about this. This is what you call a hiatal hernia. Watch this story. Normal, this lady.
Yesterday, I had a lovely 85-year-old lady named Marion. She had a lifetime. She was on omeprazole for years, burning in her throat for years of acid reflux. She had scar tissue all over her esophagus. She couldn't clean the bathtub because she threw up food when she bent over. She was told she had Barrett's esophagus. Hydrochloric acid burned her stomach. So at 85 years of age, the next clip that you're going to see, I pulled her stomach out of her diaphragm. It moved about that far, it felt like, although it didn't move that far. You're going to see the puzzled look on her face to have her stomach fixed at 85. That's her story.
Now, to catch this at 85, this lady was a little
This
disturbed.
lovely 85-year-old Marianne has had 20-some years of omeprazole, acid reflux, scar tissue, Barrett's esophagus. She's done everything, and nobody bothered to do what? Pull her stomach down.
Right.
She's going to process what just happened. I just pulled her hiatal hernia down. It moved about that far. And at 85, to get your stomach fixed, she's kind of shocked and trying to process.
She was completely puzzled at what happened. She was choked up. I said, you're going to go home, eat your next meal, and remember the clue. What was the clue? Hydrochloric acid bothered her stomach. She got it stuck up in that thing. Holding adjustments. Now, in the olden days, finding a good chiropractor was great because you could actually hold your adjustments. Why are people having so much trouble holding their adjustments today? I'm waiting for the crowd. Because there's nothing in the food. So all that glyphosate stuff is the chelating. We're being chelated with the minerals out of our body. There's nothing in the food. So to play hockey, I'm here to tell you, I've been in practice, I started my 40th year, August 3rd, on Monday. Now my colleagues are dead, disabled, or retired. Most all of them. I've played hockey, 3 nights a week for 3 decades. And to come here and do this with 3 sick days, I have to keep myself together. I treat myself for injuries before they happen. I can't afford to have an injury. There's too much, weighing on my soul to keep all this together for all you people watching. So I treat myself for injuries before they happen. And I would encourage, if you're really active, don't wait for it. Honorable mentions. She probably had, 12 gold medals. He's probably got 6. That's Scott Moyer and Merrill Davis. Now the adjustment that I'm going to show you is what neither one of those two would have got 1 gold medal if they didn't come to this office. Both of them had herniated discs in their neck. It took out their left arm. Merrill could not. Her partner, those days were long gone. She couldn't. She got a number of shots in her neck, and she said, look, find me somebody smarter than this because I got to get my neck fixed. So the adjustments you're going to see on this tree trimmer, both of them got this, and there's 12 or 14 gold medals because of what happened here. Oh, before I show you that clip, I want to share something with you. It's a well-known fact that I eat really lousy. Everybody knows this. I eat simple restaurant food. Now, to feel like I do on restaurant food, I've been here 40 years with 3 sick days. I missed it. I did that this morning. I did that in the evening. I need a lot of junk around this kind of stuff. I get my density from my shakes because I don't consider there to be too much density in the food today. I can't do it any more expensive than that. That's my shake. And I can't tell you how simple it is. I spend less money in grocery stores and less money in restaurants, and I can thrive off of that because my diet pretty much stinks. 3-4 takes out your bilateral arm weakness. 3-4, a tree trimmer. This is the adjustment I had to do on those Olympic folks to get this to work.
When I did the NHL team, I wanted to see who had strength. I went through everybody to see who was strong. This is how tangled up his neck is. It's like an active, he's the motocross active kid. Let's see if I can get him his arms back so he can actually trim trees with real arms. All the way to the, oh yeah. There's gonna be 3 moves to get his arms back to life. C3, C4, tilt your head. Oh. That's the slip disc that everybody adjusted around. Done. He had a herniated disc in his neck laying. I don't know how much different that might be. How does that feel to you?
Feels great.
You've been working that hard. I've had athletes come in with their neck so grossly out of place. That's how, and their performance completely syncs with that.
It will ruin your career. People are coming in without pain. They're just weak. Things are out of place. This is missed all the time. This might be the craziest story of the evening. This lady rolled a car at 130 miles an hour 5 times and ended up on a porch. She rolled a car at 130 miles an hour, ended up on a porch. I was her 19th doctor. 19. Here you go. First of all, if you look, that atlas is jammed. Now, rolling that car at 130, she jammed her skull on the ceiling. You can see it's open and closed, jammed and slid. All these things, you will not believe what she went through from having her brainstem pinched from rolling a car. This is my longest clip, so just wait, it's very special.
For all you doctors that I met over the weekend, pay attention. This is a pinched brainstem. This is what the atlas looks like when it's hitting the brainstem. This lovely lady flipped the car at 130 miles an hour and walked away from it. Dislocated her neck how many years ago?
20.
Listen to what happened from having your neck out of place. Go.
So what happened was, earlier in life I would start to feel that I had this jaw clenching to the point where I had surgery. I would clench my jaw so bad that the bone would protrude on my jawline.
Her jaw, she's clenched so hard that the bones growing under her teeth are pressed outwards. I've never seen this before. That's how hard she's clenched. Continue.
So you can even see after I had the surgery 6 years ago, that the jaw, you can still see the bone protruding out of my gum line. It was a painful surgery where they cut open my gum and they basically chipped it away, and other doctors would spend hours sanding it down.
I can't comprehend
Then what
this.
happened, the next thing that I really realized was that I couldn't walk in high heels anymore. When I'd start to walk in them, if I went to bed, I would have like shin splints so bad, my toes would curl, they were numb. And then I quit being able to sleep on a pillow. I couldn't sleep any way except for laying on my back with my head straight in the air. And it had to be on a completely flat surface.
How many? 18 doctors in 10 years.
Yeah, 18 doctors in 10 years for different things that I didn't think were related. I thought it was due to my age. I'm 41. And so I thought it had something to do with my age, that I was getting old, that I was just being uncomfortable. And then what started was my mother has MS. I started getting chronic fatigue. I was so tired. I couldn't figure out why I was tired. I was fighting myself, and I'm a high energy person. I started then to have pain that would rotate through my arms through.
I'm so sorry. How would happen? Huh?
For all you doctors
Can you
that I met
speed that
over
up
the
a bit?
weekend, pay attention.
All right.
This is a pinched brainstem.
We're going to speed that up.
This is what the atlas looks like.
Can you
when
do
it's
that?
hitting the brainstem. This lovely lady flipped the car at 130 miles an hour and walked away from it. Dislocated her neck how many years ago?
20.
Listen to what happened from having your neck out of place. Go.
So what happened was, earlier in life, I could start to feel that I had this jaw clenching to the point where I had surgery. I would clench my jaw so bad that the bone would protrude on my jawline.
Her jaw, she's clenched so hard that the bone's grown under her teeth and pressed outwards. I've never seen this before. That's how hard she's clenched.
So you can even see after I had the surgery 6 years ago, with the jaw, you can still see the bone protruding out of my gum line. It was a painful surgery where they cut open my gum and they basically chipped it away, and other doctors would spend hours sanding it down. Then what happened, the next thing that I really realized was that I couldn't walk in high heels anymore. When I'd start to walk in them, if I went to bed, I would have like shin splints so bad, my toes would curl, they were numb. And then I quit being able to sleep on a pillow. I couldn't sleep any way except for laying on my back with my head straight in the air. And it had to be on a completely flat surface.
How many? 18 doctors in 10 years.
Yep, 18 doctors in 10 years for different things that I didn't think were related. I thought it was due to my age. I'm 41. And so I thought it had something to do with my age, that I was getting old, that was just being uncomfortable. And then what started was my mother has MS. I started getting chronic fatigue. I was so tired. I couldn't figure out why I was tired. I was fighting myself, and I'm a high energy person. I started then to have pain that would rotate through my arms, through here, and I would have my fingers go numb and my hands go in pain or irritate. And then I had the same thing happening between my shins down to my toes.
How long did you think that you're going to be on a scooter, an MS scooter?
I mean, I thought within 2 years that I was going to die because I thought the progression was going so quickly through me. And I couldn't understand why I was having all of this pain. And I kept getting neck pain and back pain, and I thought it was stress from my job. But it was getting to the point where I had no feeling in my hands or legs at some points, and that I had no reflexes whatsoever on the left-hand side of my body. And
on the left side.
Psychosomatic.
Left side.
Does she look like there's nothing wrong with her? She's a strong personality. Folks, this is a pinched atlas. I've done this for 40 years. This is missed 24/7 by everybody. Shaquille O'Neal, the famous crooked eye story. This is her second visit. She's ecstatic. How do you feel since you had your brainstem fixed?
I mean, amazing. I actually was going to Vegas the next day, and I had rented a scooter to be able to get me around,
Yes.
and I walked the entire trip.
Jane.
I wore high heels to go to Wicked. I can actually go to sleep at night. When I left here, my jaw dropped, and I had never felt it being loose
That's
before. My
huge.
mouth was stuck open because it was so relaxed, and I'd never had that. I slept on a pillow for first time after 20 years sleeping on a pillow. First time wearing heels after 5 years. I thought that was just a part of my. I'm sad. I gave away 300 pairs of shoes.
One correct atlas adjustment. Today she just got it. How was the second adjustment? A lot easier than the first
A
one?
lot easier.
Awesome.
The first one, I felt like The Exorcist. You almost flipped my head around.
Did it work?
I was so high. It felt high. I felt like euphoric because as soon as he did that to me, I felt fluid like flush through my body. I could feel it run to my fingertips, run to my toes, and my hair was standing up on my head. And it wasn't like an instant thing. That was for 2 days it did that. And so I sat in this parking lot for 30 minutes.
30
I told
minutes.
my husband, because we live an hour from here, I said, I can't drive. I said, I gotta wait because I feel so high. And it was literally just the fluid and the neurons, connecting
It's
again.
a real brainstem pinched, an atlas wedge you see me talk about. You guys gotta learn how to handle these. She sent me 8 patients before the next day. 8. The phone went off the hook because she started talking. This is how you build a practice. It's not nonsense, it's results. She's got a new life. This is visit 2. She's ecstatic. And her husband's got a story better than this, and that's for another day.
I had x-rays done 2 weeks before this in which they told me nothing was wrong in those x-rays. I had blood work. They thought I had lupus. They thought I had all kinds of things wrong with me, and they kept coming back with nil. Who knows? Maybe they would have diagnosed me with multiple sclerosis just because of my mom without having, lesions on my brain or anything like that, and started me on medication I didn't need. I was taking tons and tons of things to make me feel comfortable.
That's a real chiropractic adjustment. Visit 2. You got a new life?
New life, honestly, the energy levels, the being able to sleep because my jaw isn't clenched walking high heels, that's a dream.
The
I
softness
didn't
in
think
your
I'd have.
brain changed your personality because you're a lot easier to deal with.
Gosh, she was rough. She was rough.
Thank you for
You
enjoying
do
your
God's
life.
work. You do God's work.
Thank you so much.
You look in somebody's mouth, watch their bone growing to the side from clenching. I have never, ever seen this. It was horrible. Now, the adjustment that I did, your dad could have done. It was not for the faint of heart. Her neck was stuck. All right, how about 3? Severe right impairment in right eye function, continuing to decline, right side weakness with walking difficulty, diagnosed with cerebral palsy, right arm and right leg weakness. Watch how you can check a kid.
Check this lovely lady's baby. Mom's perfectly adjusted. We want to know what kind of weakness this baby is experiencing. All right? Hold, get this arm out straight.
Okay.
Move your arm.
My arm?
Yeah, hold tight. Good. Get this arm up. Hold tight. Melissa, come on over here. Positive, negative, positive, negative. The eye, the side. Hear that? Hear that loud little noise? That's the atlas.
Boom.
Relax. She's perfectly happy.
Her whole right side came back to life. Now the atlas, I'm checking the baby through the mother. There's a lot of skills you guys can develop out there if you learn. Watch the lectures and learn. The coach at Michigan, daughter came in. She was told she had left-sided cerebral palsy. I adjusted her atlas. That was I caught her at 19 after a lifetime of that. My Albanian kid, the guy handed me his son. My son runs like a girl. Do something to him. Adjusting his atlas, no offense to the girls. They adjusted his atlas. He is now the fastest kid in school. He's told his story on our Instagram. Dads, you'll see the clumsiest kids out there that you have to watch for this. They can't run. Visual disturbances. The people that have to keep getting glasses because their eyes keep going down the toilet because their brain stem's pinched. I have people, you adjust their atlas correctly, they go home, their old glasses work, they don't need the new glasses anymore because their eyes were better. These are the eyes that keep going down because your brain stem's pinched. One-sided MS. You know how many one-sided MS, one-sided strokes that weren't there? Old people come in. Their brain stem's pinched. They sleep on it funny. They wake up, oh my God, I think I had a stroke. The hospital says you didn't. It's a pinched brain stem. I've done a number of those in 40 years. The sinus infection that you can't fix. If that head can't drain, it's coming down your throat. A very smart mother that's a physical therapist. The kid here was here for totally other reasons. I'm looking at this kid, and this is what happened. This is what doctoring is all about. Don't do what the patients want to do. Find out what the person really needs. This changed this kid's life, and she didn't come in for this. Oops. Right eye turns inward, holds neck tilted, right arm weak, her right leg's weak, no history of head trauma, and she's a dancer. She's here for totally other things. The mother's sitting right there, and this conversation started, and I filmed it after the fact because it's cool.
Now, I have a very active family. Dancer, what else? Skiing.
Water skiing?
Any head injuries, any trauma or anything? No. They're in here for a wellness check. They're trying to do something before something happens. I think this is the most brilliant. I was a physical therapist. So I noticed something unusual. How she's carrying her head. Look how she holds her neck. This is Shaquille O'Neal. Her brain stem's pinched. So, if you watch your eyes, see if her eyes track the same. No. So it's so obvious. I noticed something that Mom says, what?
The right eye has been going inward, but I've had it checked a lot.
How much? Tell me what a lot is. How much? We have no clue.
Yeah, different well visits and things, and we just had an eye exam too.
There's that eye exam.
All your well visits.
Yeah.
And she's a dancer, who Mom claims is coordinated.
I feel like you're not. I don't know.
She will be.
Maybe you're gonna be more.
Put your left arm, you can sit
Yeah,
up
she's a
down.
belly dancer.
Hold tight, hold your arm up, hold tight. No. She drags that arm up like it's dead.
Watch him
This is
drag
been
that
dead
arm.
forever.
That's a
This is
lame
my right
side.
eye turns
It's
in.
lame.
This is my right-sided MS. All right, the coach of U of M, the head coach of the football team, the last guy. His daughter was told she had right-sided cerebral palsy. It was this. They came to a
How
lecture
expensive
about
are these
this is
diagnoses?
perfect. Because I didn't know anything about this, but Mom was telling me some, this has got you all worked up.
I have anxiety anywhere.
This is cool.
Well, but also on her hand is that whole rash too, which is weird. That's been going on for way too long.
You bet.
This is another reason I brought it here. I don't
I
know
want
if
to
it's
say
anything to do
something,
with
but
it.
I'm really glad
Right
that
side.
you are here. No, it's just like that. I'm glad you're here for this. Use your word. Since everybody's on a job because of your Whitmer. Straighten this leg out. Hold tight. Hold tight. Now, I have a dancer. This is going to be such a cute day for her. I've had a dancer. This is the one. Get this arm up. Hold tight. Hold your arm up. Shaquille O'Neal. His right eye turned down.
Watch her mother, as a physical therapist, accept this first adjustment on her daughter, and watch what the daughter said.
Highly paid, successful athlete. This is the move that he needs. I've talked about it over and over. On your back. Watch it. This is easy. Because it's this.
Watch what the daughter says. It's a big adjustment.
How she dances, complete change of sports, everything is going to complete. Just relax.
Okay.
Everything's a complete change in her life from this day. Was her delivery difficult?
Her what?
Was her delivery difficult?
What do you mean?
Was she born?
Yeah.
This happened at birth.
Yes, it was because she didn't want to come out. I had to have a ton of Tocin and all that.
This has been jammed since it came out of the chute.
Yeah, she didn't have to. They didn't have to pull her. No forceps or anything like that. She was a big baby. I can tell you that. She was.
Watch what the kid says.
Cross your legs.
Got her name.
Boom. How big was that?
That cracked a lot.
That's a birth trauma. She's going to be coordinated when I'm done today.
They're good.
Right? That's how far the joint your neck has been since the day you were born. Now, in her head, she can tell that felt like I was supposed to go there. It moved so far, it wasn't supposed to go there, she'd have freaked out.
Are you okay?
Yeah.
How cool is that? It felt good.
It felt good.
Right.
It's not supposed to hurt. It's going to feel good.
Big side, small side. Nice job. This is going to be a gigantic touchdown for your daughter.
You
And I
just need to
felt
relax.
your neck just moved about. You do that. Your neck just moved about that far. You knew it. Just relax. And relax. This
I'll
is
go lie
easy.
over.
Okay. Done. Now, I want you to
Now, that girl's been in for her second visit, or third visit. She can turn ways that she could not turn. All her dancing's changed. When you get used to looking at a lame side of your body, you grow into it. Her dancing's changed, her whole side's changed. This happens all the time. They get used to it. Bradley Cooper, cross-side. Robert Plant, Reba McEntire. I watch these people on, you can watch them. There's so many clues if you're in the field and you're doing this long enough. All right. I got this guy scheduled for shoulder surgery. There's the neck. Watch this. How much money is being wasted because chiropractic, I want to say if we had more good chiropractors, we would be the gatekeepers. Watch and learn. That, okay. Just that wedge, just that. Pay attention, this is really good.
Tony said to me, I want an adjustment today. Really? You want an adjustment today? John is scheduled for shoulder surgery on the 20th of November. Now,
Watch
to show you,
this.
We're going to have some fun with this x-ray. That's what it looks like when it's not your shoulder. He's scheduled for surgery on November 20th, correct? Stand up for a second. This is going to be a very difficult adjustment because he fell on his head how many years ago?
30, 35.
He'll get a kick out of watching this.
When they operate on him, I asked him, where's your shoulder pain?
Watch
Tell me
this.
where your shoulder pain is. Why would you operate on his shoulder when he points there? He has a dead right arm. This is what you've seen before. He's a successful businessman. We fixed a million things in this poor guy. Have we not? Yes.
This guy was an out-of-control asthmatic when I started.
C3,
Out of control.
C4 on the right is
That's done.
calcified and stuck. It's nice and
Right on that wedge.
One, down, oh, two. Now breathe.
I make it look easier than it is because I've done it for 40 years. My hands know where to go.
Surgery. That's a dislocated neck. C3, C4 on the right. Since you fell on your head 30 years ago, now stand up for a second. I didn't think we'd have a story like this today. Put your arm out. Hold tight. There. The shoulder that they're going to operate on November 20th. And today is October what? The 23rd. Put both arms out. If you're going to have shoulder surgery, please, God, at least point to the shoulder.
Yes.
Don't point at your leg. Don't point at your ear. Point at the shoulder. He doesn't need shoulder surgery. He needs a real chiropractor.
Unbelievable. This is my whole day. And if I operate on his shoulder, let him rest, rehab it, he might think something happened. Nothing happened. You just rested something that was... All right. Al, this one's for you. A guy in my hockey league. Right there. Al comes in, he breaks his collarbone, and his wife comes in 2 weeks later and says, I don't think Al's going to play hockey this year. I said, let's shoot another x-ray. 14 days later, on the right supplements, which we'll share with you, there's a broken collarbone. There's 14 days later. Look at that. That's what nutrition can do. Isn't that crazy? Can you see it? It's growing together right there. Cracked right there, busted in half. In 2 weeks, it's growing together. 5 weeks and 5 days, he went back on the ice. His wife didn't think he'd be back this year. An incredible, how'd he do it? My bone broth shake that I have to do, you'll see that when I get to some special patients. Learn to treat your compromised bones. Not this year, the previous winter, I had more broken bones, broken backs, broken wrists, broken knees, they came in. How many ladies, how many think we had, 15? They came in with broken, yes, a chiropractor's office. People trust us to come here. Some we had to send out. Some of my foreigners, we put them in braces and healed them up, and they were grateful not spend 10 grand to heal broken parts. How about that guy's knee playing soccer? That was brutal. He still remembers that. Learn to treat your bones. There's no food for your bones in the food that we're eating today. There you go. So those two women doing my hockey shake, those two things, the calcifood, the collagen powder, and the whey. Those two ladies asked me about that. I'd like to do that hockey shake because I'm old. So this is my wall of fame. 67 and 81. Donna is 6 months into my hockey shake that I take to hold my frame together. On the same day, the same morning, she did a two-legged slip on the ice, and she said, thank God I've been doing your hockey shake. I did a two-legged slip in the middle of the winter time, and out of her mouth, she said, I bounced off the cement. 75 years old, that's how much density changed in her body right out of her mouth. And I never couldn't, I bounced off the cement. True? 3 hours later, this lady I hospitalized 3 years ago with horrible pneumonia. One lady got hospitalized, it was her. She had those saggy arms, all that flesh started to hang on her. She said, look at me. After being in the hospital, I lost my density to my body. She did the shake, my hockey shake. So 3 hours after she walks in, she's not going to believe it. I did a two-legged slip on the ice, and I bounced off the cement. I filmed both of them for saying, if you're that age and you can bounce off the cement in the wintertime, you're taking the right pills. Both of them said that unsolicited. All right. All right. You know that thing that's going around right now that you don't want to talk about? That thing that's on the news, that thing that killed the economy, that thing that killed thousands of people in nursing homes. It's that thing that destroyed professional sports, who cares? That thing that destroyed the industry. You know that thing going around that ruined everybody's education, ruined everybody's life because a couple people think if they ruin the economy, things are going to get better? Well, that thing that's going around, I don't want to mention the word because if you fix it, they'll shoot you. You can't do anything. If you talk about it, it's off limits. Dr. Brownstein found out the hard way. Let me do a shout out to Dr. Brownstein. Nice job, Doc. Keep up the good work. I've had to clean up things that come in this office after that thing. So I know she's watching. I called, and Joy, this is yours. One of my patients came in after she daddled that thing for a month and took the things that the medical community wanted. She came in with, this is the debris left over in people's chest. They're pointing at it. I feel heaviness in my, they can tell you where this is. Something's heavy in my chest. I'm not going to tell you how to fix that because talking about this gets you in nothing but hot water. I'd like to stay alive a little bit longer, but it took her a month to get that thing out of her chest where all that heaviness is gone. They're coming in pointing at where the debris is. I have something stuck right here. I can feel it. Hopefully your doctor knows how to handle it because she's watching right now and she's fixed. How powerful is chiropractic? That's me. I went to Canada and paid $5,000 for that hernia surgery because they clamped it together. I wanted to get clamped together, not stitched. This cost me $5,000 and a week off of work. How expensive is that? I have a big office. I had no clue. That one was repaired. That repaired the one on the other side. I can't believe it. So I wish I would have attacked this one because after one got stitched together, I can't believe how well. 10-10 in that cream, unbelievable. Tightened up my inguinal hernia on the right side. I'm laying in the hospital in Toronto. I'm at Shouldice in Thornhill, Ontario. My team calls me, my hockey team. Hey, Tent, think you can play this Sunday? I sent them that picture back. I don't think so. I think I'm going to be out of commission for a while. God, that hurt. They clamp it together. When they put those clamps off, you're pinched together for 2 days. That was an adventure, but it was a natural tissue graft with no stitching. That's why I went there and paid cash to have it done right. All my friends with meshes are having nothing but pain from that mesh tearing inside their body. How powerful is chiropractic? Watch this, and I'll tell you a little story. A ringing ear. 1, 2, stick your finger there. Next, your cast on. Hold. There's both. Now, so I sat her down, left TMJ. Okay. Behind your ear. Slip your jaw in place. Why did I do that? Because she had a car accident and the airbag hit her in the face. What symptoms did you have on the left side of your face?
My left arm does not track right, and my hearing in my left ear is like ringing so loud. It's like everybody else could hear it too. It's so loud. It's a lot better.
That's a TMJ. I want to do a shout out. I couldn't believe Mr. Kershaw was in today. He's watching 150 miles away. I want to do it. I said I'm going to do a jaw tonight, and I'm going to do a shout out to you because Mr. Kershaw can hear out of an ear that was deaf. Enjoy your new ear. So in 40 years, that adjustment, I've had about 8 totally deaf ears popped back in, and they started to hear again because the jaw just walked out of place. Poorly fitting dentures, lots of bad tooth stuff. So you'd be surprised how important the jaw is for your ear. All right. You want to see how powerful is chiropractic again? Real chiropractic, not that other stuff, the real stuff. Look at this. I want you to watch that C5, C6. I have a gigantic ethnic practice. I'm sorry, Americans. I love my ethnic practice. They refer, they're excited. It's a treat. Watch. This is what it looks like. This lady comes in with a wrist brace. Her wrist is killing her. Her arm and her wrist is killing her. She does not understand why. That's her x-ray. I said, that's why you're wearing your wrist brace. She said, my neck really doesn't hurt much. I said, well, that's your neck brace. That's your wrist brace.
That's how far down the arm.
Makes it look cool.
Well, it matches. I want you to cross your legs.
Okay, yeah. When you come, you're not this.
I think I got a chill about a piece of my ear.
When you come, when you're not this.
C5.
Yes.
That is a disc, and that's solid. Her hand and arm will come back to life
Now watch.
from that spot. That's a real adjustment.
Thank you, doctor. Thank you very much. Doy en mi que yo te soy proyecto.
Is she gonna kill me?
She's going to kill me? I don't know what she said. I think she's going to kill me.
Yes.
Thank you.
Do you think she's happy that her hand doesn't hurt? They're playing with her hand. There was nothing wrong with her hand. Dr. Mick, you have his name. I get this 78-year-old dentist in. They just did carpal tunnel surgery on him. His hand's the same. I said, this is your neck. He said, my neck doesn't hurt. I said, you shag the teeth, I'll fix the hand. He was a crabby guy. 3 adjustments, his hand came back to life. He goes back to the surgeon. You took my hand apart. It was my neck. Don't take the hand apart of a dentist when it's your neck. All right. She's pretty. Now, how many patients do you think these patients will send? A lot. All right. I can't lift my arms. I have problems. This guy drove 500 miles to have this done. We'll see what happens.
On the right. 57, losing your shoulders.
Losing both arms.
Oh, yes. That's the disc you slipped in your neck. C4, C5. Come on for a second. Chiropractic. Stand up and face that away. Put this on now. She's 57 years old.
His arms were dead, completely dead.
And said, I have to drive here because I think I need a real adjustment from somebody. How many miles was it? Over 500.
He's from Maryland to get adjusted. Maryland.
On your shoulders. Incredible.
He starts crying because his arms work at 57.
Now we got to get to your low back. That's how much people lose their careers. Professional athletes, guys that used to pitch, throw a football, hit a tennis racket, simple misalignments derailed their career. I personally did that to 3 of the gold medalists at the Winter Olympics a couple Olympics ago.
I mean, it scared me, but I know it was necessary.
How good does that feel?
I feel good now.
Put your arms out. Hold.
Now the second thing with this guy, he had a bit of a numb leg. That was pretty much not. So he had an accessory articulation. There's a little extra vertebrae. That bottom disc was giving him trouble. So there's only so many times people can drive 500, 600, 1,000 miles to get adjusted. I'm encouraging the locals to watch my lectures and make it so you guys can do it locally. I'm not trying to take your patients. I'd like the entire profession to be uplifted to have these results. This is the guy's leg.
I'm going to find out if his toes are numb. Let's see which leg you're dragging up. got an accessory articulation.
Got a
Thin
funny
bottom
development.
disc, lay on your side and face this way. Breaking out of the medical paradigm that he was trapped in for 55 years, like most of the people watching this Instagram. Stuck. Let me just wait for a second. I got out of that medical world when I was 12 years old. Put your head down. This is easy. I started with the hard part on purpose. Fast one goes to your feet. Put your other side up.
Watching myself is pure torture, so I hope you just enjoy this because I hate it.
L5, L6 on the right. On your back.
So his leg came back to life, hopefully. Yeah, he's doing fine. Now, this is important because when I went down and did the lightning back in the 90s, the first person had a bad foot. The biggest problem was a crushed, dislocated foot. A heel, arch, and an ankle is out of place. This is kind of important. Everybody wait, when you throw yourself out of place today, they'll send you to the doctor, give you OxyContin, give you something to the physical therapist, and he's going to exercise the part out of place. They put you on Advil, they exercise your part out of place, and it's completely ridiculous, but that's what makes America go round. Simple stuff. 3 years, this is one of the guys I grew up with, sister's kid. This guy, his wife messages my wife, his mother, can they see my son? So this kind of came backwards. I walked into this. Watch this. This kid's had a bum foot for 3 years. He's physical therapist. He did all this stuff for it.
This kid's had a bum ankle for how long?
Listen.
A couple of years at least. A couple of years. It hurts on the outside the most.
These are hard to do. I don't like them.
Oh. Did you hear it? Yeah. Let's pop his ankle back in place.
It's his arch. I said the wrong thing. It's his arch.
I feel tingly all the way up.
There you go. There's a dislocated ankle.
Arch.
Just watch it get popped in place. You saw me put his ankle in place. Now I got the story. He said that sound felt exactly like how it happened.
Yes.
Explain to the crowd how it happened.
So I was walking down the stairs and I stepped on a shoe and my ankle rolled and it snapped almost identical to when he snapped it back into place. So it popped back in pretty much.
You went to the hospital.
Yeah, I went to the ER and they didn't see anything wrong with the ankle itself.
Does it feel good?
It feels way better, for sure.
Good.
Now, for you doctors, hear what he said? When it made the sound to go in that it made when it was going out. Simple. Listen to the sound. He's walking with a limp, but the physical therapist exercised out of place for a couple of years to make sure it would stay out of place forever. Physical therapists are great, but we always take misalignments and we exercise them until they stay permanent misalignments. Find a real chiropractor, get it adjusted correctly, then do the physical therapy. You might be surprised how it works. Perfect disc space, nice parallel lines, looks big stud. This guy does lots of working out, big strong weightlifter. Watch this.
To show you something interesting on a young stud like this young man, come on in here, take a look. I want you to, with an old L3, L4 injury on the right, take a look at the legs. Look at this full leg in here. Look at the difference. The amount of atrophy that you can see.
Isn't that crazy? His leg is shrinking.
Old disc injury, how we record trauma. It's interesting to see, hold tight, how much atrophy and how dead this leg is on this gigantic weightlifting group. It has no clue. His leg, look at the difference. That's having an old slip disc in your back for about 200 years. That makes your leg give out. You're going down the stairs and nobody has any clue how your leg gave out. It's been there so long, the leg is shrunk. Unbeknownst to him. Lay on your side and face this way. L3, L4. This is what it's like to get out of place professionally. L3, L4. Face that way. This is the famous one on the pros that they thought they had knee trouble. That's how atrophied it is.
With no back pain, all in the knee.
Your disc that you thought wasn't bothering you that much. Pain fibers fatigue quickly. Your leg just starts giving out, and you don't even know why it's giving out because it doesn't hurt that much. Feet out straight. This is a real adjustment on an old herniated disc on a guy that works out.
It takes 3 moves to get that disc in. That's why I'm doing all this on that same spot to get it. It's not easy. If it was, everybody'd be doing it.
Stand up, lay down. That's all I want you doing. Lay back down. Go back down. Face up. Face up.
Face up. For God's sakes, I lay face down.
This leg up. Hold tight. Hold tight. Now,
People will miss this. Now let's discuss this. Look at that back. Look at this.
this is Mary. She comes a long way to adjust that extremely crooked spine, as you can see. Mary, how old were you when you knew you had that spine?
I was 75.
She was 75.
Look how crooked that spine is. I think I got it. That's her spine. I have a relative that they took one look at that, did a $150,000 operation with those rods, screwed her back together. 6 months later, one of the screws was going into her leg, so she was getting a numb leg. They had to do a $50,000 operation to bend the rod to get it off the nerve that was going down her leg. That's my niece. You can have this and not know that you had it. She had no clue her back was curved. She could move one way farther than the other, but today, if a doctor saw that, what they would put that kid through, you'd wish you'd have died. You saw me adjust an arch. Watch this. This is a whole different kind of adjustment. It's a calcaneus.
Terry has dislocated her calcaneus. Calcaneus is out of place. Relax your foot.
These are hard. These aren't easy.
On your foot, on the calcaneus. Relax this foot. One, two. That's a calcaneus.
It's a hard move to get that heel back in place. X-rays. That spot will make the right hip hurt. That one will make the left knee hurt. And that disc is ruptured. Beth, you'll recognize this. Beth watches. She was a dental hygienist. Well, we got this lady through I couldn't even tell you about because I don't know what they do to me. That is what it's like. And she lives pretty well pain-free. She gets adjusted, every month or two. And she can survive with that and not know it's there. We're getting there. The world's greatest back support, which I never use back supports, but these are the back supports that won me over. So you doctors, you can encourage your patients to use these. It's the world's greatest back support. You can loosen it. I totally recommend that on patients that have real tough disc injuries till I get it to settle down. An Invertrack, we sell those at the office, but the bad backs will encourage people to pull their discs apart. Really helps your system especially if you sit all day and you got crushed discs. That makes your back a lot easier. Try to shop local. If you like what we're doing, support DHS because Amazon and Jeff Bezos does not care about you. DHS does. Let's see. Where am I at now? There we go. All right, we're getting close to the big event. All right, frame support, since I'm talking about skeletal stuff. There's how you grow your teeth back if you got roots. There's a choice, there's a choice. I put some of that in my shake to keep my frame strong because I don't eat bone minerals. Hockey knees. Fantastic for inflammation, fantastic when your joint's all inflamed, you can put the fire out without fixing it. So things get all inflamed, they don't seem to be getting well. Learn to use professional fire extinguishers and they work extremely well. Inflammation, things that work outstanding for inflammation, which we'd like to use you want to be with your doctors for this kind of stuff because there's some interactions with some medications. Work with your chiropractor on this. There's my hockey shake, whey, calcifood. There's the two ladies bounced off the cement. That's the shake that they did, that they realized their spine is different. Motor nerve support. BG, B stress, some options if your nerves are wearing out. All right. One more. Sensory support. Peripheral neuropathy. Old diabetic nerves, things that are, chemotherapy nerves, etc. Help grow some of your nerve endings back. That should help. All right. You ready? Here we go. All right. On August 3rd, 1981, I walked into the office across the street. I was 23 years old. I can't believe that I started this journey then. So, my 40th year started Monday. Now, to tell you about some interesting things about DHS, in February of 2022, my lease is up here. That would put me at 42 years in practice. I'm kind of burnt out. I'm kind of stressed out. It's taken a tremendous toll on my family and my life. And we're contemplating possibly, you want to fold this up and stop? Everybody said, what? I said, yes. I toyed with the idea of folding up my little show, going on and having a normal life, and saying goodbye to this life and seeing what round 3 might have been for my life. But with all you people so kindly, so respectfully asking me to never stop, because these people have humbled me with how kind they've been to me. So to change some things in my career, something special is going on. I got a crazy idea a long time ago, and you're going to hear about the crazy idea. I've had no vacations for a number of years because I can't afford to leave here because it's too expensive. Amazon challenges all of us because everybody buys stuff from Bezos and wears us out. Support the office if you want us to stay here. So, there was a gentleman, let's just go where we're going. I started this about 20 years ago. I went to a seminar, a chiropractic seminar. I'm sitting in the back row with your father. I don't know who this guy is. It's 20 years ago. I'm sitting there. Somebody walks up to him and says, "That's Dr. Tent." And he looks at me. Now, I drove this man nuts because in our life, every time he went out in public, and he's a famous chiropractor, and he told people, said what he did, the first thing everybody said to him was, "Do you know Dr. Tent?" He said, "Yes, I know Dr. Tent. I want to talk about me, not him." So he heard my name enough times. He didn't know who I was. We're sitting next to each other at a seminar in the back. A doctor walked up, "That's Tent." He looked at me, "Are you Tent?" I said, "Yes." "Are you Dr. Gill?" "Yes." We hit it off right in the beginning. We were sitting there, both of us, with practices more complicated than the people teaching us. We're in the back shooting spitballs at each other because our practice, he has a very sophisticated practice like mine. And we have to take continuing education seminars with people that aren't at our level yet. We're pretty much in the back talking and having fun, visiting back and forth is what we always did together. So I decided one day, hey, do you think you could give me an adjustment? I walked out, we went in the hall, I got an adjustment. I just looked at him. It's my adjustment. I said, you don't get paid enough to do this. I was blown away with his adjusting. He's got real hands. So over time, every couple of years, we'd hook up. He's got a big practice in Brighton, a big practice in Berkeley. And I said to him back in November, I said, I'm afraid to sign a 7-year lease. I can't work 5 days a week for 50 years because it's going to wear me out. I said, I got an idea, Dr. Gill. How would you like to come work at my office with me? So an idea started brewing back in November of last year about the famous Dr. Craig Gill. So in our life, this guy eats, sleeps, and breathes chiropractic. And talking to him, I realized, holy Toledo, he's one of the best guys in the state. Let's do a little history before I bring him up here. His family's up here. You're going to meet his family. Dr. Gill has been in practice for 25 years. He's a standalone practitioner. He's ran 3 practices by himself. He's fantastic. He eats, sleeps, and breathes chiropractic. He's more into this profession than I am. He chose this. I was pushed into it. My mother pushed me into this, and I made the best of it because the good Lord wanted me to do this because I had a knack for it, but it wasn't my first choice. It was his first choice. What he's going to bring, expertise, he teaches the physicians how to read blood chemistry. He teaches the physicians how to do female hormone analysis. This guy is a coup to get for DHS. I will probably tell you that I'm going to probably last another 10 years here with a strong person to help me out like that. Dr. Jeff's been a great asset also. Dr. Gill's a standalone guy. Watch what his skill set's like. He eats and lives this stuff. 1994 graduate of the University of Health Science. He went to National College of Chiropractic. One of 3 chiropractors. He's lectured for Henry Ford Hospital. And he lectures to the Michigan Association of Chiropractors, teaching them how to read blood work. 25 years of experience, and for all you doctors out there, I'm going to put a bug in your ear. We're going to probably be lecturing, me and Dr. Gill, in Franklin, Tennessee in the spring. We're going to have some fun. You guys are going to have a blast. We're going to see some clips. We're going to teach you some things that you don't know. I know everybody's been pestering us to do this, and we're going to probably pull this off sometime in March or April. Just I want to make one last thing before I introduce Dr. Gill. I am not retiring. My schedule might be cut back a little bit in the future. Dr. Jeff is not leaving the office. Treatment plans will be better and enhanced. We'll continue to have the same great care you've had forever. I'm going to introduce Dr. Gill. Enjoy one of the strongest chiropractors that I've ever met in my life.
Well, thank you, Dr. Tent. Let me just start off by saying it's an honor to join your team, and it's an honor to share the podium up here lecturing with you. Before I get started, let me start off by saying this. Dr. Tent, Dr. Jeff, and I will make a heck of a team. In fact, it'll be a huge advancement for the chiropractic profession and the patients of this office. Whether it be a virtual appointment, an in-office appointment, chiropractic care, nutritional care, or any other type of health benefits that we offer, having more chiropractors is always an advantage to the patient. And in this healthcare climate today, it is time. So, let's see where I came from. Okay, my journey. So, discussions of chiropractic. Have you ever been out with strangers, your family or friends at an event and heard the miracles of chiropractic? My chiropractor got rid of my migraine. My chiropractor got rid of my heartburn or my hiatal hernia. Or my chiropractor, if it wasn't for him, I wouldn't be able to walk because I had a disc in my back, and now because of him, I can continue to do my job. Or the athlete that comes in and says, you know what? Every time I get adjusted, my eye-hand coordination is better, and I can play better. Well, this was my life. My family and I grew up in chiropractic care, and we lived what you talked about and heard about the chiropractic profession. So, my father in 1950 went to a chiropractor because he had migraine headaches. He resolved those migraine headaches. From that time on, going to see him, the chiropractor taught him, look, chiropractic's not just about back pain. Chiropractic balances the nervous system and stimulates the immune system. So naturally, when I came into the world in 1968, at 2 weeks old, I started to be treated chiropractically. I never had a pill or shot in my life, In fact, the first needle I ever had in my arm was in 1989 when basically I was having my wisdom teeth removed. Since that time, any additional needles I've had in my arm was to basically donate blood or to run blood work analysis to determine what nutrition I needed to keep the maintenance on my health. Now, my family is made up of 5 boys, 2 girls, and we were adrenaline junkies in Livonia. In fact, so much so that 3 of my brothers almost lost their life to 2 snowmobile accidents and an ATV accident. My brother Neil took a single strand of barbed wire into his mouth. If it wasn't for the helmet, the way it protected the face, it would have sliced his head in half. What it did do is it ripped him off the snowmobile, pulled him 10 feet in the air, and plucked out every one of his top teeth, to the point where now he's got posts and fake teeth. My brother Rodney, similar situation, flying down the trail, came into a short turn, hit the bank, flew into the woods at God knows what speed, and hit a tree and spun around it like a top. And Terry, he was on an ATV, racing his ATV, came off of his ATV in a jump and landed his shoulder right into the next mound. Could have been his head. All 3 of them were very close to death. You could see why we needed chiropractic care in this family, but we had a situation. Our chiropractor was getting older. Who's going to take over? Who's going to treat us? So naturally, because I liked school, as a senior in high school, my sister said, you need to become a chiropractor. So I went to school, got all the degrees, finished the chiropractic college, and I've been in practice now 26 years. Basically, I tell people I treat a variety of conditions. I say it like this: everything from hangnails to hemorrhoids and everything in between that affects the spine is what I treat. Now, in 1997, I came across a book called Eat Right for Your Blood Type by Dr. Peter D'Adamo. Basically, in that book, it's a genetically based diet that talked about nutrition or food and lectins in food and how they affect the blood type. I said to myself, if this is true, what about nutrition? Nutrition's got to have an impact or effect on blood type. And so as I opened this door to this new area of study, I found out this was exactly true. To give you an example, if you take a blood type O person that typically will have digestion problems and you put them on psyllium husk, which is a bulk fiber laxative, you will create pocketing gas in that person and they will not like that product. If you take likely or similar a blood type A person, you put them on Bladderwrack, which normally converts the thyroid hormone T4 to T3, that Bladderwrack will make them feel anxiety or make their skin crawl, and they will say, I am not taking that no more within 2 weeks. This is the door I opened up, and I said, wow, look at the difference we're getting by using the blood type to understand the nutrition. We put it together, and the results are phenomenal. That's one of the things I plan to bring to DHS. Another thing I plan to bring to DHS is my analysis of blood work, and a third thing is bringing an outside source in to run echocardiograms to do pre and post studies on the heart and vascular system and how the nutrition improved the vascular system, improved the heart. Now, let's get into looking at how me and Dr. Tent met. Well, basically, I have a little different twist on it possibly, but he's right. We were at a seminar years ago, and a rep, I thought it was, came up to me and said, hey, Dr. Tent needs an adjustment. Can you give him an adjustment? We went in the other room, as he said, and basically a little bit of small talk. I worked up his neck. I adjusted his neck, and he, like Dr. Tent fashion, he got up and he said, perfect, and he walked away. And I thought, perfectly good or perfectly bad? I wasn't sure. It wasn't until about 2 weeks after that, or 2 months after that, the rep came in and said, hey, by the way, I got to tell you, Dr. Tent said that's the best neck adjustment he's ever had. So we started sitting in the back of the room, being friends, realized a few things. We went to the same high school. We also had the same chiropractor, or our mothers had the same chiropractor as we were kids, and we would share all the clinical experiences that we were seeing. So that's how we met. So what I want to do now is get into how does Dr. Gill adjust? Let's see this in action. So let's look at a case here. I think you might recognize this case once we get to it, but this guy here, 25 years ago, his older son jumped on his back and took out this disc right here, L3, which is lumbar disc. You can see on the right side it's compressed there. On the lateral view here, you can see that the back of the vertebrae don't line up, L4 is slid forward on L3, which basically traumatizes the disc by shearing the disc, narrowing the IVF where the nerve root comes out, and this will cause all kinds of problems. Let's see his next x-rays. So we look at the neck x-rays and we see C3, 4, 5, or 3, 4, 5, and 6. Basically, you can see the curve changes there, and you can see each vertebrae, you can see this scooping out here. I'd call that a nuclear impression. I'd say this guy had some downward force on the head, either sliding into a hockey board or jumping out of a tree as a kid, landing on his head. But you can see those nuclear impressions. Regardless, it's going to cause all kinds of problem. Let's see what we did for him, and let's see who it is. There we go.
Many people have asked me, do you get adjusted? Of course, I like to tell a new patient I don't believe in this stuff, and they makes them look befuddled, but actually I'm a patient also. This is the gentleman who's been adjusting me for the last couple of decades because I was very comfortable with his adjustments because he's been in practice a long time. Now, what I consider the most underutilized treatment on earth is real, pure chiropractic. For example, about 25 years ago, my oldest son jumped on my back when I was laying on the bed, blew that disc out. I was crooked for a week. I put support on, worked. I recorded an injury. I ruptured L3, L4, and it looks like that. Now, I played hockey 3 nights a week for 3 decades on that ruptured disc. But I have to keep adjusted properly because it affects my left leg from my knee up. I really don't know what's there if it's in place where it's supposed to be. And at this age, every 6, 8 weeks or so, to keep my back free and my legs happy and strong, I have to get intelligently adjusted. My neck, on the other hand, I got some old injuries from lots of years of playing sports that makes my left arm act up. When my C4, C5's out, my left elbow can drive me nuts. And you'd swear it's your elbow, it's actually my neck. Very few people have been able to adjust my neck correctly, and Dr. Gill is a serious mechanic that I have enjoyed getting relief from, that very few people have been able to give to a guy that's in shape, strong, 30, 40 years of trampolining and hockey. I'm really crisp and tight. It's not easy to get backs that are adjusted that are strong and athletic. So 3, 4, I'm turning myself over to Dr. Gill.
Not to mention the fact that this is important. Through the first 6 vertebral arteries in your neck, you got the vertebral artery going through the first 6 sections of your neck. So when there's any kind of misalignment or there's a lack of movement in there, you're going to change or stifle that blood flow to the brain or through the cervical spine. So when I adjust Dr. Tent's neck, we notice a big change with him as far as circulation too. So let's not forget there's baroreceptors wrapped around that vertebral artery that also send a signal to your heart. If there's too much blood going through the vertebral artery, it'll slow down the heart, and if there's not enough blood going through it, it'll speed up the heart. So not only are we regulating blood flow to the brain, but we're also regulating those baroreceptors to the heart. So let's adjust your neck, Dr. Tent. Come on over here. I'm going to put you in the chair. So this is a privilege, because to see a chiropractor adjust a chiropractor, that's just a privilege. But with Dr. Tent, being that he's a chiropractor, he knows he's going to tighten up a little bit more than most.
And I'll tell you, when he adjusts my crisp neck, what's the commonest thing I've said to you over 2 decades? You don't get paid enough to do this. Because he does it brilliantly.
Absolutely.
C4, C5, L3, L4 on the left is a spot that just perfect. As you see with real chiropractic, I need to be moved.
Now I'm going to drop this one. I'm going to use the leg. Drop it. There it goes, right there.
Now in my 40 years of practice, my left side is where most of my pinched nerves have resided. Thankfully, I'm right-handed. But to watch how exciting it is to have my body come back to life and have everything not hurt. So after 40 years in practice, I don't really have a lot of major injuries slowing me down. But one thing I do want to share with you, my dad had a knee replaced. I have a couple of really old hips. I take lots of nutrition to slow this down. In my 70s, I might end up with some hip issues, particularly my left one. I'm trying to push this back as far as I can because you don't want general anesthesia until you have to. That's a first-class adjustment. You're the best. Thanks.
Odd handshake. Okay, so let's see what we're doing with this chiropractic care, what we call chiropractic care. If you recall, I said, my chiropractor said you're balancing the nervous system, you stimulate the immune system. If we look at this chart here, we will see, and because we're from Detroit, I always attribute everything to a car. So I look at the spinal cord in the brain as like the wiring harnesses to a car. A wiring harness in a car carries all the electronic signals to all the componentry of the car. Well, if we look at the spine this way, the brain is the battery, the spinal cord and the nerves go out through openings in the spine, which is affected by positioning and movement of the spine, but they go out through openings to every cell, tissue, and organ in the body. The only ones that don't are the cranial nerves that affect the motor and the sensory of the face and the head. But the rest go out through openings in the spine and affect every one of these organs. It moves at about 250 meters per second square. That's almost the speed of light. So what that means is this: if you touch a hot stove, you'll retract that hand even before the swelling or the blisters begin to form. That's fast. That's how fast that moves back and forth. There's two reflexes that work on this. There's something called a Somato-visceral reflex, and there's another one called a Visceral Somatic reflex. Now the Somato-visceral reflex is this: if there's a spinal movement problem or misalignment, it'll carry an aberrant signal or an improper signal to that organ that it's going to, or that tissue, or that cell. This has been researched, and they know that if this is not the right, if we don't have the right flow of nerve flow to that organ or cell, it's going to suffer. Also, on the opposite, we have the visceral somatic. That's where you have an organ not functioning correctly, like the heart, and it'll refer back to the spine, the first four segments in the upper part of the spine, and it will make changes to the spinal column up there. It might tighten the muscles, it might create some inflammation, but that'll create problems up there. Let's give you two examples of this. If you look at a visceral somatic reflex, when you have a bad gallbladder, chiropractors out there will know that it'll refer back between the shoulder blades. That's where that nerve goes back to the spine. So if you're adjusting somebody, they're not responding to that mid-back pain, you very well could have a gallbladder problem. Or on the other side, the opposite, the somatovisceral reflex, if you cut the first four nerves in the upper back, the thoracic spine, immediately the heart will beat at 100 beats per minute. Typically, the heart should beat at about 60, 80 beats per minute, 72 being perfect. So if they're cut, that's how much integrity or power the spinal cord has to controlling your organ systems. Very important. Now, move forward here. So, some people adjusting better than others. This is a term that I'll say in my office called bamboo spine. For the chiropractors out there, if you're adjusting somebody and you notice, like, I've been adjusting this segment for a few times, it's not moving, it's not positioning correctly, they're not responding, you have to start to think of something. This is probably the visceral somatic reflex that I talked about. What I mean is the organ's not functioning right, sending that bad signal back, and it will tighten that area of the spine. I have a personal case in point for you on this one. I didn't tell you this, but years ago, at about 42, I lost my father to cancer. My mom had to work 4 jobs to put food on the table for 7 kids in the house. Little rags to riches story. But here's what happened. She was so busy, so stressed, she had a crappy diet. She ate chips and everything. Steve Slock out there, you know what I'm talking about. She would eat chips at night doing her paperwork. Basically what happened was she had a heart attack. She had 3 stents put in. But what I noticed is she had that bamboo spine in the upper back. Constantly, it didn't move. So my mom came to me and said, look, now I got to trust you because I don't want to leave here early. What do we need to do? I put her on a nutritional program for her heart. And what we noticed, lo and behold, in 2 or 3 months, all of a sudden that upper thoracic spine started to adjust like she was 17 years old. It started to move like it was supposed to. Now, to confirm this further, my echocardiogram team that came in, they came in and they did the echocardiogram on my mom, and her heart scar was doing this. That scar was beating. Now, if you know anything about heart attacks, what happens is you'll get a scar in the heart, the area where you had the heart attack, and that won't beat anymore. When we did the echocardiogram, Cindy, who's never seen this in 35 years, said, "Dr. Gill, I can't believe it. It gave me chills. Your mom's scar is contracting with the rest of the striated muscle of the heart. It's working." My mother's 90 years old. Probably shouldn't say this, but she's dating a guy 14 years younger. We call her the oldest cougar in Brighton. Great lady. She's always on the go. She's full of energy, and that nutrition will make all the difference in the world. But remember this, if you have somebody with that bamboo spine out there, they're not responding, start thinking of what nerve, where that nerve is going, what organ it's affecting, and what's going on at that organ. Test that organ and start a nutritional program if needed to correct that organ. I promise you, time and time again, I just seen it this morning with a patient of mine, time and time again, that area of the spine will become flexible again. Let's move on. So, another thing I always say in the practice is to see is to know, not to see is to guess. So x-rays, I still love to take x-rays when they're needed. In this case here, you'll see a lady came in, 50-year-old lady, right lateral pain over the fibular bone. That's right here. Pain is constant. Put an underline there because that's important. The pain was constant. History was she's with a local chiropractor, diagnosed a misalignment of the fibular head, and he continued to treat it several times. Now, I'm going to tell you something about the fibular head misalignments. They will not be constant pain. They will be pain on foot flat during the heel strike foot flat toe off. It'll be pain on the foot flat that'll be a sharp sudden pain, go away immediately, or when you twist the leg, you'll feel that pain. It'll be a sharp, subtle pain. It'll never be constant. So when she came into the office, started talking to me about what was going on, I said, we got to take an x-ray. We took the x-ray, and if you look at the x-ray, the left fibular head looks perfect, no problem. You slide over here where the red circle is, you'll see this fibular head is dilated, looks pedunculated, looks blown out, radiolucent. That was a giant cell tumor of her fibular head. Remember what I said, constant pain of that fibular head that's not responding. Most fibular heads will respond with a couple of treatments, usually one. But it's it not responding, you got to do the x-ray. We found the giant cell tumor. We sent her out. I did nothing for her. I just sent her out to the surgeon. And what they do for this, they cut off the top of the fibular head, sewed her up. Now she's back in our office treating other conditions of the spine. Success story. Whoops. Okay, 51-year-old male. Symptoms, cluster headaches. Pain will be debilitating where he can't move, and he will literally pound on his head. I watched this guy have a headache, or a cluster headache, and I watched him punch himself in the head from the pain of it. Full out punching himself in the head. Nausea, vomiting, visual disturbances. Pain will move around, no specific location. 2 spinal surgeries. I'm going to let this video speak for itself on that. You can see the spinal surgery here, the screws, the hardware, holding the lower part of the neck together. Let's see what happened. Jeff, tell us about what happened when you were after those guys in the car and you tried to reach your hand in the window.
Well, it was now going about 20 years ago. The problems that I'm suffering from now have accumulated over the years. It was an unfortunate incident where a subject was addicted to drugs and we were trying to arrest him for possession of drugs. And I reached my hand in the car to try to get the keys out of the ignition. He took off in the car with a truck, the pickup truck, while I was reaching in. Took me along for a ride, dragging me down the street, and I ended up ultimately falling off the vehicle at about 60 miles an hour, about 50 to 60 miles per hour. says the witnesses. Got run over by the truck and hit my head and tumbled. My partner who was following behind me
broke his
estimated
neck.
that I probably tumbled about 30 times on the ground, head over heels, before I finally came to a stop. And suffered some pretty bad injuries, but I recovered.
So basically, this guy tumbled 30 times, did basically what I say, cartwheels down the street on the side of his car, and was thrown off. It was major headlines, folks.
Okay, so let's see the continuation of this.
So the other part about Jeff that we didn't talk about is when he put his hand in the window, it was the right arm. He went down the street with these guys in their car at about 60 miles an hour doing end over ends, cartwheels, finally flew off the car and landed on his shoulder. What happens is it messes up his roll and glide mechanism in his shoulder, gives him a lot of pain. I'm going to show you how we adjust that roll glide mechanism in the shoulder. All right, Jeff, just stand right there. Now let that shoulder just relax. Let the arm play dead for me if you would, okay? Keep the head straight, looking forward. Good. All right. Hold this up tight now. Hold. Good. Now hold this one up tight. Resist. Much better. This is what happens to you when you put your hand in the window of a car and try to take the keys from a perpetrator. This is a good patient of ours, Jeff, and what he was doing is trying to apprehend some bad guys, stuck his hand in the window, and they took off with his hand in the window. Now, here's what happened to him. You can see it damaged his neck to the point that they had to do screws and plating in the neck. Jeff still gets his occasional migraines. If we don't adjust that atlas on the left side, he gets these tremendous migraines that he can't deal with. So I'm going to show you how we can specifically adjust around this condition that he has in his neck, the screws and the plates, still adjust that atlas and give him the relief he needs so that he can live daily. So we're going to adjust that atlas. Ready, Jeff? Yep. Okay, let's slide you down just a little bit. All right, so it's a thumb cervical atlas is what I call it. We're going to go right after that. Drop down. Right in there. And drop. There it goes. Very nice. How'd that feel, Jeff?
Very good.
Fantastic.
Yeah, very good.
That's how you move that atlas without rotating those lowers.
Now, when we first adjusted Jeff's shoulder the first time, I'll never forget it. Thank you, Jeff, for your service. He's a police officer. He's watching the streets for us. But when I first adjusted that shoulder, and he said, I don't know if we can fix his shoulder, and I adjusted it, I didn't know if he was going to punch me or chase me out of my own office. But the next time he came back in, he said, that shoulder feels so much better, you got to do that again. And it's fixed his shoulder tremendously. But if we don't do that thumb cervical atlas on the left, those cluster headaches, not migraine, those cluster headaches are so bad that literally he would punch himself in the head. Now those headaches have subsided. Jeff is doing much better, and I'm telling you, as we continue with Jeff, I think these headaches will be completely gone in a matter of time. But fantastic guy, does good work. Let's see the next patient. Now, 9-year-old male, seizures averaging 1 to 2 times a month and varying intensity from mild seizures to grand mal. Patient currently being treated by a neurologist, which has advised against chiropractic treatment. What happened here, he was in a tubing accident where he was tubing, came up to look around, and the tube came around and caught him right in the head. Now, medications he was on, and he was a zombie when he came in to see me. He was on Lamictal and Tegretol. Literally was like a zombie. The mother told me, I'm tired of the neurologist keeping increasing the medication. She goes, I go into his office and his whole waiting room is like a bunch of zombies. I don't want my son to be a zombie anymore. So we started treating Jimmy, and the results were phenomenal. We had to take away a few things, the blinking games, some of his Game Boys and stuff like that were setting off the seizures. But here's his story.
Okay, prepping for this seminar, I said to myself, boy, would I like to have Jimmy come in, because what a story he had with chiropractic care. And lo and behold, he walked in today. That's God sent. But Jimmy, I'm going to have him tell you what he first came in here for and what we did for him. Jimmy, when did you first come in? Let's talk about that first.
I came in to see you when I was about 9 or 10 years old.
Okay, and what did you come in for?
I was having epileptic fits and grand mal seizures.
Okay, and how often were you having those seizures?
They started off slowly, but then they progressed up until 7th grade when they started to be about every month, maybe twice a month.
Okay. And what happened after I started to treat you?
They slowly dissipated, and then I was able to go off the medication.
Okay. Now, when I was treating you, you were also seeing a neurologist, is that correct?
That's correct.
And you were on Lamictal, correct?
Lamictal and Tegretol.
Okay. What did the neurologist say to your mom? Do you remember that?
He said that we should not be consulting you.
Okay, or seeing me, right?
Seeing you at all, yeah.
Okay. And what happened with school? What were they telling you about school?
The neurologist said it would be unlikely that I graduate high school.
Unlikely that he graduates high school. So, do you remember the history of how your neck got misaligned?
I think we figured out that it was in a tubing accident when I was younger.
Okay, so he was tubing behind a boat, fell off, came up to look around, see what had happened, and that tube swung back around and wham, hit him in the head, creating an atlas wedge up there that we started treating. As we started treating it, his seizures dissipated. We also had to give him a little bit of magnesium because of a little bit of deficiency we found. And lo and behold, have you had a seizure? When's the last time you had a seizure?
I was 15 years old, so about 5 years after they started.
Yep. And you haven't had a seizure since, correct?
Correct.
And what do you do now?
I'm an attorney and an investment analyst.
So he graduated high school, went to Ivy League U of M, and now is an attorney, and he was told he'd never graduate, all from an atlas wedge. That's what chiropractic can do for you.
Now, Jimmy's neurologist, and how that story went is the mother went in and said, you know, I'm seeing these results. I'm seeing Dr. Gill, and as Dr. Gill continues to treat my son, we notice that the seizures are going down and down and down. I'd like to back away from the medication. She said, I'm tired of every time I come in the past, and we kept upping the meds, and he kept having the seizures. So I'd like to decrease the medication. The neurologist said to her at that point, he said, listen, you keep seeing that guy, and I'm not going to treat you anymore. And his mother said to him, well, then you're fired. I'll find somebody else that'll work with us. And that was the story behind that. Jimmy's an attorney now. He lives in Chicago. He came in town just recently. That's how we got that footage. And he's doing fantastic. Hasn't had a seizure in years, not even a sign of a seizure. He's doing fantastic. So this is going to conclude my part of the seminar. And I'd like to say this before I turn it back over to Dr. Tent. I'd like to thank Dr. Tent, Dr. Jeff, and the entire staff for welcoming me to the clinic. I haven't started yet. It will be soon. And I will tell you, it's a fantastic team that we're going to have here. We are going to change lives with this clinic. With that being said, I'd like to bring Dr. Tent back to the floor.
Thank you very much for that wonderful adjustment. Well, we got just a couple slides folks, I'm going to tell you, this guy can read blood work. He's starting November 1st. As he's finishing up his practice, his patients will be coming here. So you guys get your blood work together. He's a master at analyzing blood chemistry, and he teaches the physicians. You're going to have this be a great asset to us. Hopefully, the next 10 years of my life, I don't have to try to work myself to death. I'm going to have him help. He can work himself to death with me. Please support local. The local people are being killed in this economy because the state of Michigan is being run by crazy people. We're losing control. It's a mess. Please support the little guy because he doesn't have a chance right now. Now, I want to do a shout out to Nora and Martin. It's a Friday for Dr. Gill has had these experiences. On one day, 2 patients, Nora came in with her husband. I was her 16th chiropractor, and I was Martin's 12th, I think. And so these 2 folks, I don't adjust them much anymore because they're holding their adjustments, they're doing well. I can't imagine going to 16 chiropractors. 1 would have been it for me. I want to give a shout out to all the people that I've been their 3rd chiropractor, their 6th one, their 8th one. Thanks for not giving up on chiropractic. People like Dr. Gill, Dr. Jeff, and me are out there making big changes. Now, we're going to get more into this in December. Immune system, simple nasal sprays. Put it up your nose at work. Raise your natural killer cells. Viruses hate C and calcium and magnesium. If you talk about helping people, they put you in jail, so keep your vitamin D up because that thing really worked well if you didn't have any vitamin D. Keep away of that thing because you know how troublesome that is. Last call, that funny chemtrail flu. 4 of each of those. Be surprised what you can cough up. Amazing. Flu season. Simple things. Start now. Support the office. Start before it happens. I'm going to tell you, this is my 40th flu season. I thought this year was a piece of cake. I don't know what everybody's looking at. I don't know what kind of political game's going on, but all the doctors did not see. It's been overplayed in the media. I can't believe what I witnessed after 40 years in practice. It's a disgrace what's happening right now. The good Lord gave us an immune system that can handle most things thrown at it if it's fed well. In the work, you people trapped with all those infected people, keep that in your purse, spray it up your nose. Before I go to bed tonight, I'm going to take a shot of that up each nostril, a shot in my mouth all night. I have silver and iodine clearing out my sinuses, handling all those infections around my bone graft infection, which you'll know more about at the next lecture. I want to thank Dr. Gill and his family. Did you get your family up here? Yeah. Oh, they said, okay, great. I want to make sure. I didn't bring them up. Get up, come on up here. I want Dr. Gill's family. Come on, he's got lovely daughters, a lovely wife. I didn't think you brought him up here. I'd like to introduce your family to the DHS crowd. Introduce your family.
This is my youngest daughter, Brooklyn. This is my middle daughter, Lexi. My oldest daughter on the end, Shelby, and my wife, Nicole.
So I think I can believe he understands female hormones because he has to stay sane in this tribe. Thanks for coming. Support DHS. Welcome to Gill family. We'll see you in December.